Hello GCSE PE students, this is my under 20-minute revision of all of exam models. Trying to get through this as quick as I can. I'll speak quickly and stop and pause the video at any point and check the slides. There are a few mistakes on the slides that I will talk over. I'm sure you'll know that anyway. So let's get to this. So first we've got the structure and function of the musculoskeletal system. So you need to know what the bones are. The bones are the picture on the top left are the key bones you need to know. And what are the functions of the skeleton? Well, they protect the vital organs, such as the cranium protects the brain when heading a football. They give you structure and shape and muscle attachment. So the skeleton provides support by providing a structural shape for muscles and tissues to attach. You get formation of bones, of joints for movement. So two bones meet at a joint. That joint is where they move. For example, when throwing a ball in handball, the elbow creates the movement, or the shoulder creates the movement to allow that movement to take place. We get red blood cell production. So blood cell production, the red blood cells that carry oxygen, the white blood cells that fight infection, and platelets that clot blood. This all takes place in the bones. They also store minerals, so calcium and phosphorus are stored in the bones, which help to keep them strong. The structure of the skeleton. So we have some key bones. You can see a mistake here already. We've got flat bones twice. So first we'll look at flat bones. Flat bones provide protection. The best example is the cranium. Okay, they protect vital organs. Also the rib cage. So when chesting a ball in football, you really protect your heart, or the cranium protects the brain when heading a ball. Short bones absorb impact. Or they bear weight. So the toes are the best examples, or the fingers. So the fingers, when you're catching a ball, the fingers will absorb the impact of the ball, or when running, the toes will absorb the impact of your body weight on the floor. Long bones. Okay, long bones basically provide your movement at the bones we think about most of the time, so your humerus, for example. So when you're throwing a ball, the humerus will create the force to throw the ball. Your long bones, they basically provide movement and work as levers. We'll look at levers later on. And finally, which is not written down, is irregular bones. Irregular bones, as far as you need to know, are the same as flat bones. They provide protection and some muscle attachment. The best example to give is the vertebrae, which protects the spinal column. You need to know about ligaments and tendons. So a ligament attaches bone to bone, a tendon muscle to bone. There are different types of joints. So we've got a hinge joint. The best examples of a hinge joint are the elbow and the knee. Okay, and we have a ball and socket joint, which is the shoulder and the hip. Now, I've told this before in class, imagine humans, well, all mammals used to walk on four legs. And so humans used to do the same thing when people learned to stand up. Why am I saying this? Well, basically, both our arms and our legs structurally are very, very similar. So your elbow is basically the same as your knee. They can do flexion and extension. They're hinge joints. And your hips and your shoulders are basically the same. And they are ball and socket joints that provide all sorts of different movements. We've got the key movements there. Flexion, which is decreasing the angle of the joint. So bicep flexion. And you've got extension, which is the opposite. Same with the knee. Abduction, which is taken away. Adduction, coming back in. Plantar flexion, pointing the toes downwards. Dorsiflexion, the toes going upwards. Rotation, which is this movement here. Rotation around a joint. And basically that provides spin onto a ball. So if I'm throwing a ball and I rotate, that will provide spin. Also when I'm doing swimming, that will allow me to cut through the water. Circumduction is like a cone-shaped movement. Okay, we see that when bowling a cricket ball, or when doing the butterfly or front call on the shoulders. They're the best examples. For each of the types of joint, you must be able to give an example. Okay, so flexion, you can say elbow flexion when bowling a ball underarm. Or you can say abduction. A goalkeeper abducts his arms to save a high ball. These are all examples. Plantar flexion, the toes pointing downwards when running. Okay, a bit more about the musculoskeletal system, the muscles you need to know. Okay, so we've got the muscles on the screen so you can see them. We talk about the different types of muscle contraction. So muscles work in pairs first. You have what's called the antagonistic pair. The agonist is the working muscle, and the antagonist will be the relaxing muscle which allows the agonist to work. So if I'm doing a bicep curl, for example, my bicep muscle will contract, it will be the agonist. But to allow that to happen, the tricep will need to relax, which will be the antagonist. So the key ones you need to know are the key muscle pairs: bicep tricep, quadricep hamstring, gluteus maximus hip flexor, gastrocnemius tibialis anterior. These are the key ones that you'll need to know. And one's contracting, one is relaxing. We've got muscle contractions, what they do. So firstly, any movement when a muscle contracts is an isotonic muscle contraction. Okay, a concentric muscle contraction is the muscle shortening. So when we think about concentrating the muscle, the concentric contraction is the muscle shortening, and that's what creates force. The eccentric contraction is the lengthening of the muscle, and that basically is a braking system. So if I'm the downward phase of a bicep curl, that's eccentric because it's slowing the weight down. So if I'm sprinting and I want to stop, as I'm slowing myself down, I get an eccentric contraction. Other muscle contraction is isometric. Isometric muscle contractions are when a muscle's contracting but not moving. The best example is like a rugby scrum, when two groups are pushing each other, they put all their force into it, there's no movement. An arm wrestle, when no one's moving but you're contracting. So it's the muscle contracting but not working. And on the right hand side, it's got the function. So have a look where they are, see where the muscles are, what their function is, and the sport example. Have a little read through that list. Okay, next, the cardiorespiratory system. So we've got to know the pathway of air into the lungs through that system. You can see there what their jobs are. You see on the screen on the left hand side. Okay, next thing is gaseous exchange. Gaseous exchange takes place in the alveoli. Okay, these are tiny, very thin air sacs with thin walls, only one cell thick, to allow oxygen to exchange, gaseous exchange, with carbon dioxide. So when you want to respire or breathe out, the carbon dioxide will be released and the oxygen will come in. And in the alveoli, if the alveoli coming back will be full of carbon dioxide, and that will switch with the oxygen in the lungs, which is gaseous exchange, so that the oxygen can get into the body. Okay, next the blood vessels. Arteries. Arteries almost always carry oxygenated blood, apart from the pulmonary artery. But basically, arteries take blood away from the heart. So the pulmonary artery is taking blood from the heart to the lungs to be reoxygenated. But every other artery carries oxygenated blood. They have thick muscular walls, okay, which is very, very important. That allows for vasoconstriction and vasodilation. Vasoconstriction is the artery getting smaller. Vasodilation is it getting bigger. It gets bigger, so if you're working your biceps, doing a bicep curl, that muscle needs more blood at that moment. So the artery will vasodilate, sending more blood to the active area, because you need more oxygen there, more nutrients, and it will vasoconstrict to areas where it's not needed so much, such as the legs in that moment. Okay, you've got veins. Veins have thin walls because the blood's carried at a low pressure. They have a large lumen, so a big inside. The most important feature they have is they have what's called valves. The valves stop the backflow of blood. Because the pressure is low, because of gravity, if there wasn't valves, the blood could go back on itself, which you don't want it to do. So veins have valves, a key feature. And finally, capillaries. Capillaries happen at the end of arteries or veins, basically in the muscles. They actually diffuse the blood, so they diffuse the oxygen and carbon dioxide into the muscle, into the lungs, and then one cell thick to allow that to take place, to allow that gaseous exchange to take place. Okay, a bit more of the heart, you'll be aware of the pathway of blood through the heart, which we've got there. Okay, and the top right will tell you that the pathways, where you want to start from. And a key thing to be aware of this is that the left ventricle, if you can see the left ventricle, this the side which is the myocardium or the muscle, is thicker. That's because the left ventricle is carrying blood around the whole body. So that muscle, the fitter you get, the more blood it can pump, because that muscle next to the left ventricle is thicker, allowing a bigger contraction. That's also why, when we talk about bradycardia a little bit, bradycardia is a resting heart rate of less than 60 beats per minute, which happens when somebody is very, very fit, as we say, because their left ventricle has got lots of muscles, so it can pump lots of blood per beat. We've got on here, we have, I'll move my little picture here so you can see it. Okay, we've got inspiration, expiration, to know about inspiration and expiration. So when we inspire, we breathe in, the diaphragm and external intercostal muscles contract. Okay, and by doing this, they expand the rib cage. Okay, and by doing this, it increases the volume of the chest cavity and causes air to rush in from the atmosphere. So remember, air wants to travel from high pressure to low pressure. So by expanding the lungs, we're making the pressure lower than the atmosphere, so the atmospheric air wants to get in. We breathe out, we do the opposite. The diaphragm and intercostal muscles relax. Okay, and by doing that, we're creating a smaller thoracic cavity, a smaller lung as such. And so the pressure is higher in the lungs than the atmosphere, so the air will escape and that's how we breathe in. During exercise, we get a little bit of help, so we can inspire more by using the pectorals and the sternocleidomastoid muscle, which is not so important at GCSE level so much. And when you breathe out, the abdominals will help you. You need to be aware of cardiac output and stroke volume and heart rate. So cardiac output is the amount of blood leaving the heart per beat. Stroke volume is how much blood is ejected from the heart per beat. And heart rate is the number of times the heart is beating per minute. So to figure out how much blood is being pumped around your body, you need to know your heart rate and your stroke volume. When you times heart rate and stroke volume, it gives you your cardiac output. Obviously, as you start to exercise, both your stroke volume increases, as does your cardiac output, which is such As you exercise, your stroke volume increases, as is your heart rate, so your heart will pump harder, stroke volume, faster, heart rate, and that will lead to an increase in cardiac output. If you're asked a question on that, you should mention all three things. So, what happens to the heart or the cardiorespiratory system during exercise? Okay, well, stroke volume increases, more blood leaves per beat. Heart rate increases, so your heart beats more times, thus you have a higher cardiac output. This means that more oxygen can be delivered to working muscles. Lung volumes. On the right hand side, you see that tidal volume is about air inspired or expired in a normal breath. As you exercise, your tidal volume will increase. Okay, so tidal volume is how much you're breathing in that moment. As you exercise, that will increase because you need more oxygen in and more carbon dioxide out. Vital capacity is the maximum amount of air in the lungs can expire after the maximal inspiration. So basically, your vital capacity is the maximum amount of air you could possibly have in and out of your lungs at any one time. As you exercise, your vital capacity decreases because your tidal volume increases, and they're linked. Expiratory reserve volume is how much more you could expire. Intraspiratory reserve volume is how much more you could inspire. And finally, the residual volume is the bit left in the lungs at all times. So there's always be some air in your lungs, and that's the residual volume. Next slide. So, there we go. So I'll move my little picture again over to here. Okay, so aerobic exercise. Aerobic exercise is using oxygen for energy production. It's basically long distance events such as long distance cycling, marathon running, triathlon, anything long distance is aerobic. We're also always working aerobically. Okay, now aerobic respiration uses both glucose or carbohydrates and fats for energy. Okay, so you can use glucose or fats plus O2, oxygen, and that produces carbon dioxide as well as heat and energy, which is what you want. And exercise is very different. And exercise, one can't use fats, you only use glucose, or glucose, stored glucose is called glycogen, and that is broken down when needed, and it's used only for a short period of time. What happens is, when you're working anaerobically, you produce lactic acid. Lactic acid eventually burns out, and so it burns, it's that burning sensation in your muscles, which will make you need to stop. So when you're working aerobically, your body will break down the lactic acid so you don't feel it or notice it. When you're working anaerobically, lactic acid will build up to the point of pain, or you'll have to stop. So anaerobic is for your power events. Okay, it doesn't use oxygen, it's for your power events, sprinting, shot put, weightlifting. Whereas aerobic is for your long distance events over a long period of time. Okay, basically you don't need to know much about this, it's been covered a tiny bit. It's been called EPOC, don't worry too much about it. But essentially EPOC is after you finish exercise, you need to consume more oxygen to replace the lost oxygen. And that's called EPOC. So after the exercise, your breathing rate remains higher, and the reason for that is so that you can recover, break down the lactic acid. So I'm playing my slide now. Okay, the next one, recovery phase after vigorous exercise. So what can we do to help ourselves recover? We can use cool down. So cool down is important to help release lactic acid. Usually light exercises, stretching to help ourselves recover and avoid injury. Massage, we massage away from the heart to help get rid of lactic acid and help reduce inflammation. We use ice baths. Ice baths reduce swelling of an injured area. We can also use rehydration, so lots of water. And finally, lots of carbohydrates and protein. So carbohydrate will replace the glycogen stores, the carbohydrate stores in the body. That'll help us recover faster. Okay, the long and short-term effects of exercise. So immediate effects of exercise. You start exercising, what's going to happen right now? We're going to get hot. Okay, heat's going to rise. We're going to sweat to cool ourselves down. We're going to have red skin. So remember that when we exercise, our skin goes red. It goes red because the blood vessels to our skin vasodilate to help heat escape, and that's what we'll do. We get increased depth of breathing to get more oxygen in, and we get increased heart rate. Other short-term effects of exercise, okay, which happen more 24 to 36 hours after exercise. We'll be tired, okay, we get muscle pain, we get DOMS, which is delayed onset muscle soreness, you get cramps. This doesn't happen immediately after, but it's a short-term effect. And then finally, we've got the long-term effects of exercise. Long-term effects of exercise are things like changing body shapes. You'll get more muscle mass, okay, you can lose body fat, okay, you get improved stamina, improved cardiovascular endurance, you get increased size of the heart. So you get improved cardio, what's called cardiac hypertrophy, a stronger heart. You get a lower resting heart rate. These are all long-term benefits or long-term effects of exercise. Okay, levers. Three types of lever: class 1, class 2, class 3. I'll go through this very quickly, you can read on the screen there. First class lever, the example is heading a ball, it's at the neck, it's got a mechanical disadvantage. Okay, it doesn't particularly create much force. However, if the lever is long, remember we did this in class with the giraffes, a long neck creates lots of force. So in the human body, we don't see a great deal, we don't see an advantage in a class 1 lever. However, in sport we do. For example, a rowing boat. A rowing boat has long oars, that creates a mechanical advantage. Class 2 lever, when you see it in the ankles, it's got a mechanical advantage, like a wheelbarrow, it's walking on your tiptoes. You don't see it at the ankle. Basically, imagine how much you weigh. So I weigh 92 kilograms. If I'm walking all day long, my gastrocnemius, which are quite small muscles, don't get particularly tired because I've got a mechanical advantage in that lever. The final lever is a class 3 or a third class lever. It's everywhere else in the body. Okay, muscles get tired. It's got a mechanical disadvantage. That's why muscles get tired quickly. Let's move this over so you can see. Okay, so examples are identifying lever systems. Okay. Next slide. Planes and axes. So again, this is confusing, but it's simple. Okay, the frontal plane, okay, is forward and backwards movements. So if I step forward or step backwards, I'm stepping through the plane. That is the frontal plane. So a bicep curl, kicking a football forward, these are all the frontal plane. The sagittal plane is side-to-side movements. So for example, if I go up a dive sideways to save a ball, that's the sagittal plane. And the transverse plane is basically sort of rotation movements. Okay, so twists. Got the axis. The axis are the opposite. So the sagittal axis is doing a cartwheel. Okay, so it's a cartwheel. So the cartwheel is the frontal plane sagittal axis. The frontal axis is like doing a forward flip, a somersault, a forward roll, and that is the frontal axis, a forward rolling system. Sagittal plane, frontal axis. And finally, the transverse plane is linked to the vertical axis, and examples in sport are doing a full twist. Okay, you need to be aware of that. Look at the picture on the right, it's basically a way of analysing the basic movement in sport examples. Next slide. Okay, a bit more. Okay, the components of physical fitness. Okay, we've got the health-related components, and we've got the skill-related components of fitness. Firstly, keywords you need to know. Okay, what is fitness? Fitness is the ability to meet the demands of your environment. That can be different. Again, we said this in class. Is a sumo wrestler fitter than a marathon runner? Not necessarily. If the sumo wrestler is world class and the marathon runner isn't, Some muscles could be fitter, they're better able to meet the demands of their environment. Also for human beings, like, you've got to be fit to do what your job is. So you might be fit for one thing but not fit for something else. Okay, health. Health is a complete state of emotional, physical and social well-being and not merely the absence of disease or infirmity. What does that mean? To be healthy, you need to be healthy, the whole package. Physically healthy, emotionally healthy, socially healthy. So do you have friends? Are you not depressed? Are you physically active as well? These are all things that lead to health. It's an important link between fitness and health. Being fit helps you be healthy but isn't necessarily. You can be fit but not healthy. An athlete, for example, a professional athlete, might have depression because of the pressure of their sport. Or maybe they have injuries because of their sport. So they are fit but not healthy. Performance, which is not on the board, on the screen, sorry. Performance is how well you can complete a task. That's also an important word that you need to know. Some key words. First, we've got cardiovascular fitness. Cardiovascular fitness is how well your heart and lungs providing oxygen to work in muscles. Muscular endurance. Again, we always go to this. It's how long a muscle group can last. So if I go running and my legs get tired, that's muscular endurance. If I'm out of breath, that's cardiovascular endurance or fitness. Flexibility is the range of movement possible at the joints, how flexible you are. It prevents injury. It also means you can do certain movements like a bicycle kick in football, requires flexibility, or a side volley. Reaction time, how fast you can react to a stimulus, how fast can you react, go, very important in sport. Power, okay, so again, power is speed times strength. The biggest muscle can't always produce the most force. Okay, the bodybuilder can't jump the highest. It's how fast you can contract that muscle, which is power. That's what's needed in jumping high, in punching fast. Speed, how fast a body part can move. That could be the arms, the legs, basically important in all sports. Agility, how quick you can change direction. Okay, very important in lots of sports such as football to be a defender, but be careful, it's not important in all sports. 100-meter sprinter does not need agility because they're running in a straight line. Balance, maintaining a base of support. So basically being balanced. If you drop yourself down lower or widen your base, you will be more balanced. Coordination, using two or more body parts together. Good coordination is important for moving hand to eye coordination, foot to eye, foot to hand, left to right. All sports require a level of coordination. And finally, strength. How much force your body or muscles can produce in one contraction. Next slide. Okay, fitness testing. You go through the fitness tests, what they're for. So what's the key fitness tests here? Multi-stage fitness test, standing stalk test, Illinois test, 30-meter sprint test, vertical jump test, sit and reach test, ruler drop test, wall toss test, the bleep test for sit-ups, the hand grip diameter test, and the 1 rep max test. I'm not going to go through each one, you can read them on the board. There's some limitations of testing fitness which are important to be aware of. Okay, so why do we test fitness? Testing fitness is important, one, so we know where an athlete is, so we can design a training program based on their current fitness levels. It also gives us a starting point. There's also motivation. I want to beat that score. You can monitor your training progress. You can see, am I getting better or not? And you can also see if your training program has been successful. Limitation. Okay, a lot of these fitness tests that we look at are very general. Okay, they're too generic, so they're not necessarily specific to your individual sport. Okay, the movements often don't simulate the sport. So there might be, for example, the ruler drop test is for reaction time. That may not be the same as a goalkeeper making a save in football, for example. The test needs motivation, so some people might do better because they can be bothered that day. They also require some level of reliability. So, for example, if it's slippy on maybe a sprint test, you're going to get the most accurate results. Next slide. Okay, principles of training. So we've got sport, principles of training, specificity. So specific means that the training is specific to the sport you are doing. So if I'm training for football, I'm doing football. Okay, individual needs, which is not on there, but it's an important one, is that you're training with individuals. So two footballers don't train the same. Okay, because they've got individual needs that are different requirements, but they'll be doing specific things for their sport. Progressive overload, gradually increasing the work that you do to create adaptation. Okay, that's important because if you don't change what you do, you don't get fitter and stronger, which is the point of training. Reversibility. If you stop training, you lose it. If you don't use it, you lose it. So reversibility is you need to make sure it doesn't happen. And a big reason that would happen would be for injury, because of injury. Tedium. Transition shouldn't be bored. If athletes are bored or trainers are bored, they will not want to continue. So you must be interested in different variety. Fit principles. If you don't apply the fit principles, you will not get fitter. Frequency. How often you train. If you train more often, you'll get fitter. Intensity. If you train harder, you'll get fitter. Time. If you train for longer, you'll get fitter. Type. If you change the type of exercise that you do, it will make you fit. You should be constantly changing these variants, fit principles. Target heart rate zones. To improve your aerobic fitness, you must work at 60 to 80% of your maximum heart rate, and aerobic 80 to 90. How do you figure out your maximum heart rate? 220 minus your age. To improve strength and power, you want to be working above 70% of your 1 rep max, and to improve muscular endurance, between 50 and 70% of your 1 rep max. Types of training. Continuous training, which is basically continuing at the same speed for more than 20 minutes to improve cardiovascular endurance. Fartlek training is the best method of training to replicate sports. So basically you're going to change the terrain, change the speed, change the gradient, replicating team sport environments. Circuit training is station of work followed by a period of rest. You can work for 20 seconds, rest for 10, 20, 10 is very easy to change because next time you can work for 30 or 12 or 40, change the rests. You can do a massive variety of exercises. It works for a whole team, it's easy to change. Interval training is good for speed. You might do a sprint, then recover, sprint, then recover. Plyometric training, the best for power-based events, basketball, long jump, hurdles, where basically it's bounding movements. So you do an eccentric and then explode into a concentric. Weight training, you're basically lifting weights to cause the muscle to adapt. You want to improve endurance, you lift a lighter weight, lots of reps, you want to reduce strength. It's a higher weight, lower reps. And finally, stretching. Okay, so stretching will improve your flexibility. Helps avoid injury as well. Okay, injury prevention. How do we prevent injuries? Complete a warm-up. Don't overstretch. Don't overtrain. So you have to recover. Take adequate rest so that your body can recover. You can use taping and bracing. You can remain hydrated. You can wear appropriate clothing and footwear. So if you're wearing a gum shield or shin pad, you're starting to get injured. And then you can use the correct technique. So improving technique will avoid injury. High altitude training. Training altitude has its benefits, because you're training altitude, there is less oxygen in the air, so that will increase red cell, blood cell production, increase hemoglobin. So when you return to sea level, you'll be able to perform at a higher level. Benefits of high altitude training is that what increases red blood cell count, it means that you're going to be able to last longer. The limitations are it's expensive, the adaptations take time, and then the adaptations or the benefits wear off very, very quickly. Okay. Creating a season for sports. So it's how do we create sports for season? We've got the pre-season, which is known as the preparation phase, where you're going to build basic fitness levels. Okay, and then after you've built the basic fitness levels, you're going to start working on skill-related components, building the team together. With a competitive season, where basically your training is keeping you fit, but you're not trying to build fitness, you're just maintaining. And the post-season is when you're recovering. So you're letting your body recover and rest, you're getting rid of injuries, you're ready to start a new season. Okay, warm-up. 3 parts to a warm-up. Pulse raiser, so you're going to increase your heart rate, you're going to stretch to avoid injury, better dynamic, and you're going to do some drills so you practice the skills of the sport, so you're used to the skills you'll be doing before the sport. Benefits of a warm-up: mentally prepare for the exercise, more oxygen getting delivered to working muscles, the temperature increases of tendons and ligaments, reducing chance of injury, and you get more range of movement, so you become more flexible. Cool down, light exercise followed by some stretches. Why do we cool down? Removes lactic acid, helps us prevent DOMS or muscle soreness, brings the heart rate back gently or slowly, and helps prevent dizziness and blood pooling. And also by doing stretching, we can improve flexibility of the muscles. Okay, using data. Look at the table. This is all sort of common sense. You've got to be able to read the data on tables and explain how it works and what trends that it shows. Look at these graphs here. I'm going to tell you, for example, what group of people are training the most or has obesity risen in certain times. Look at the graphs. So look at the graphs and have a study of that. Okay, that's just finished now. Good luck with your exam. Use this stuff, slide through it, hopefully listen to it, and that should give you everything you need for exam 1 GCSE PE.